Hi everyone, welcome back. My name is Amanda Gold, and today we're joined by Carlos Martinez, Language Services and Culture Competency Manager here at Intermountain Healthcare, to talk about how we're providing healthcare access to our Hispanic and Latinx community and our communities around the state. Carlos, thank you so much for joining us. We really appreciate it.
Thank you for having me.
So I want to start with you explaining a little bit about your role, how long you've been in this role, and why you enjoy your work.
I've been in this role for about 5 years, but I've been an interpreter here at Intermountain for 10 years now. And I love my job because I get to come to work and help people who are in the most vulnerable situation there, usually are in their lives when they're seeking healthcare, and they have a language barrier. So we get to be there and put them on equal footing with those that speak and understand English so that they can have the same level of access and participation in our services.
And I know that there's a lot of different services available through the patient rights and federal regulations that exist in the country. Can you tell us a little bit about what those services are that Intermountain offers?
So we provide free interpretation services in over 200 languages to all members of the community, whether they are patients, family members, or visitors. Title VI of the Civil Rights Act of 1964 is one of the main laws that states that no one can be discriminated based on the country of origin being one of those protected classes. So language is considered to be something that is tightly attached to a country of origin, therefore it's a protected class. We also have Title III of the Americans with Disability Act and the Rehabilitation Act, who offer additional protections to provide reasonable accommodations for those who have a disability or are deaf or hard of hearing. And most recently, Section 1557 of the Affordable Care Act expanded these protections and also provided additional guidelines as to who is qualified to provide interpretation services and in what manners we can use technology to expand the availability of these services. So our policy at Intermountain is to provide the services free of charge at every point of contact and during all hours of operation.
How does it work if you're in the hospital or at a clinic and you need services? How do you find out that these exist, and how does that process work?
Yeah, we have posters in all of our clinics and hospitals advertising the availability of free interpretation services in our top 15 languages in the state. We also provide notices in our forms and significant communications to our patients to alert them of the services. All they have to do is request for an interpreter, and we call for one. We can provide the services either in person or on a moment's notice. We can provide interpreters through video or telephone, accessible 24 hours.
And how are we ensuring effective communication to our patients? And how does this really fit within Intermountain's mission and values to make sure that we're helping everyone live the healthiest lives possible?
Well, it's critical that we take care of all people in our community. As we know, the most vulnerable are usually those who tend to seek care the latest. So we measure the health of our community by the health of those who are more vulnerable. And people who are a minority, whether it's ethnically or linguistically, tend to be statistically among those who have lesser levels of care. So making sure that everyone has access to healthcare is critical in our mission to help people live the healthiest life possible. So we just make sure that everyone is aware of that information. We provide training to our caregivers of cultural sensitivity and competence so that they are aware of the signs of someone that may need communication assistance in any way. And then provide the means for them to communicate this to our department so that then we can look at the resources available, whether we can bring someone in person or, like I mentioned, through video or phone, just to make sure that we can make it accessible at any moment's notice for everybody.
You mentioned that we have over 200 languages, too, that we can do interpretations for. Mm-hmm. What are some of those top languages that we typically use, and how does it work if you're a caregiver and you encounter a patient who doesn't speak English and you're not sure what to do? How does that work?
So we have different tools for that. So some of the main languages that we find here, obviously Spanish is one of the top languages in the state, American Sign Language, and then it goes to Mandarin and Vietnamese, Cantonese, Korean, so Asian languages, is the highest growth at the moment, surpassing the Hispanic or the Spanish speaking. Is the highest growing group here in the state. And then we have Arabic, Russian,
Lots of them.
lots of languages
That's pretty
that
cool.
we provide. On staff, we have Spanish interpreters, Portuguese, Russian, Mandarin, and Cantonese. But then we contract with vendors and agencies throughout the valley and throughout the states for the remote interpreting options to provide services as well.
Has there ever been a language that we've encountered that we haven't had the ability or to help with, or the resources? There's lots of languages in the world, so has that ever happened before?
There are, and yeah, there was an incident where we had a patient who spoke a language, and I can't recall the name of the language right this moment, but there were 6,000 people in the world that spoke that language.
Wow.
And they happened to be here in Utah at that time, and because of the rarity of the language, it was from West Africa, there were no qualified interpreters available through any of our vendors that we could find, especially here in the States. But we contract with several agencies so that we can verify through them and through their contacts until we can find someone who's qualified to do the interpretation. So we're lucky that with technology nowadays, you don't need to rely on an interpreter being here in Utah in order to provide these services. We can, as long as they're anywhere else in the U.S., we can make them accessible as well.
That's pretty cool. And speaking of virtual, we're in this weird phase right now with the pandemic, with COVID-19, where a lot of visits are going more virtual as well. How do interpretation and language services work when you're not face-to-face with a patient?
Yeah, that's been a big transition for our team. We were used to doing most of our interpretation face-to-face, but with the pandemic, we've had to adapt to technology. And luckily, we had the infrastructure ready for a situation like this at Intermountain, so we immediately transitioned our staff to providing video and remote interpretation. We have iPads throughout all of our clinics, throughout the system, where they can select the language from the screen and an interpreter shows up in a matter of seconds. And we can provide interpretation, being able to see and hear what's happening, which is second best to being there in person. Most recently, we've been able to also integrate with our telehealth equipment. So in our patient rooms, they have these big TVs with equipment, and we're able to just pop up on the screen and provide interpretation that way, which has been a great help with patients who are COVID-19 positive and are in isolation, because we can continue to provide an interpretation, meet their communication needs without bringing a body or a person into the room and having to use the protective equipment that we're trying to save for our essential services. And with our virtual visits, many of our patients and providers are meeting now electronically. So we have Connect Care as one of our virtual telehealth platforms, and we're able to bring the interpreter as a third party, as a conference call, just like in Skype or Facebook, or when you can bring other people in. So we can bring in the interpreter through those platforms as well, and continue to provide our services even when the patient and the provider may be working from home or being at home receiving care.
That's very cool that we're all able to do that. I have a quick question about caregivers.
Yeah.
I'm going to switch streams really quickly. So I know that we also have caregivers who speak ASL or do not speak English. How does that work? Do you work with that at all on getting those people to feel more, not accepted, but understood, I guess, in their department? I know that I'm thinking specifically, we have 2 ASL caregivers down at Dixie Regional Medical Center that are EVS techs, and they have a really cool experience with their team where they have phones that will speak for what they're saying, and that's how they communicate. Do you do any sort of work with that team at all, or is that a little bit separate?
So we provide translation of certain important communications for caregivers, particularly in Spanish, and sometimes, depending on the caregiver, we have provided translation of important communications in other languages so that they can stay informed and feel safe and included. But yeah, we also have caregivers who are deaf or hard of hearing and use ASL, where the availability of the iPads has been really great. Since they're in every department, wherever they go, they can just grab an iPad, get an interpreter, communicate, and participate in the same way anyone else would.
So we're not stopping those people who don't speak English as their first language from being a caregiver here, which is really great to hear.
It is. And we also provide free English as a second language classes for our caregivers whose first primary language is not English, to help them in that progression as well.
That's very cool. I have a question about how you become an interpreter. I know that last year we ran, not a campaign, but we were looking for people who were interested in becoming interpreters for Intermountain. There was a couple different languages we were looking for. How do you become an interpreter for Intermountain? Is there a process for that? Is it a specific job title? Mm-hmm. If you speak a unique language that you think would offer benefit to the community, how do you get involved with that?
So in order to become a certified medical interpreter, there is a 40-hour course that is required as a baseline of education for ethics. And once a person completes that course, then they can apply for the certification exams. There is a written exam, and then there is an oral exam. Okay. The state has a certification program that is not mandatory, but candidates who want to have the state certification need to pass the national level certification, and then can apply for the state licensing, which we require of our employees. So, once someone has completed the sufficient training and has 1 to 2 years of experience, they can become a candidate to be employed directly through Intermountain as an interpreter. We only, like I mentioned, currently hire Spanish and a couple of other languages, but through our vendors and agencies throughout the valley. People like those unique languages, maybe someone speaks Marshallese or Navajo, or a language that we may not see very commonly at Intermountain, enough to have someone employed full-time, but they can work through our vendors and as independent contractor provide services.
That's very cool. Carlos, any last thoughts or closing statements that you want to mention just about the different services that we offer through the interpretation or anything like that?
Just want to remind people that the services are available, that they are free. All they have to do is really request them. We're doing the best we can with the pandemic to make sure that the services are also available remotely. We have dedicated networks for our iPads to ensure the best possible quality for remote interpreting. In the case of our community members who are deaf and hard of hearing, if that doesn't meet their needs, we still bring people in person on a case-by-case basis. But the services are available remotely for everybody's safety. So just remember that your language barrier or anyone's language barrier should never stop someone from coming and seeking care. It's really important that they seek care and that they know that they will receive the best care possible in their preferred language if they come to Intermountain.
That's a great ending statement. Thank you. And if you guys are interested in watching this Facebook Live in Spanish, we are going to be going live very shortly in Spanish for you guys as well on the Intermountain Hispanic page. We also have a couple different resources available on our website. You can go to intermountainhealthcare.org, and if you scroll all the way to the bottom of our website in the footer, there's a non-discrimination page that you can check out that lists the different services that are available, the language that are available, and you can get a little bit more information about that policy as well. We also still have our COVID-19 hotline available that you can call to get screened and find out where to get tested. That phone number is 844-442-5224. Our emotional health relief hotline is also available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. The emotional health relief hotline is available as well as the COVID line in a couple of different languages, so if you need help there, we can definitely help you. Thanks, everyone. We'll speak with you next time.